Suicide is a complex and multifaceted issue influenced by a combination of psychological, social, biological, and environmental factors. Here's a detailed explanation of why people may commit suicide. 1. Mental health disorders. Mental health conditions such as depression, bipolar disorder, schizophrenia, and anxiety disorders are strongly linked to suicide. These disorders can lead to intense emotional pain, hopelessness, and feelings of worthlessness. 2. Substance abuse. Substance abuse can increase the risk of suicide. Drugs and alcohol can impair judgment, reduce inhibitions, and increase impulsivity, making individuals more likely to act on suicidal thoughts. 3. Trauma and abuse. Experiencing trauma, such as physical, emotional, or sexual abuse, can contribute to feelings of helplessness and despair. Traumatic events can leave lasting psychological scars that increase the risk of suicide. 4. Chronic pain and illness. Individuals suffering from chronic pain or debilitating medical conditions may experience a diminished quality of life and ongoing physical and emotional suffering, leading to suicidal thoughts as a way to escape their pain. 5. Social isolation. Loneliness and social isolation can lead to feelings of despair and hopelessness. A lack of social support and meaningful connections can make individuals feel like they have no one to turn to in times of crisis. 6. Family history and genetics. A family history of suicide or mental illness can increase the risk. Genetic factors may contribute to vulnerabilities that increase the likelihood of suicidal behavior. 7. Financial and employment stress. Financial difficulties, unemployment, and job-related stress can create feelings of hopelessness and despair, contributing to suicidal thoughts and actions. 8. Relationship problems. Issues such as divorce, the end of a romantic relationship, or conflicts with family and friends can lead to significant emotional distress and increase the risk of suicide. 9. Bullying and cyberbullying. Experiencing bullying, harassment, or cyberbullying can lead to severe emotional pain and feelings of worthlessness, particularly among young people. 10. Lack of access to mental health care. Limited access to mental health care and support can prevent individuals from receiving the help they need to manage their mental health issues, increasing the risk of suicide. 11. Hopelessness. A pervasive sense of hopelessness about the future, feeling that things will never get better, or believing that one's situation is inescapable can lead to suicidal thoughts. 12. Impulsivity. Some individuals may act on suicidal thoughts impulsively, especially if they have a tendency toward impulsive behavior or are experiencing a moment of intense distress. 13. Stigma. The stigma surrounding mental health issues and seeking help can prevent individuals from reaching out for support, leaving them feeling isolated and without options. 14. Cultural and societal factors. Cultural attitudes toward suicide, societal pressures, and exposure to suicidal behavior through media or social networks can influence suicidal thoughts and actions. Thanks for watching. Don't forget to subscribe to get further interesting and useful content.